Welcome to another deep dive. We're going deep into the inner ear today.
Oh, wow, the inner ear.
Yeah, really trying to understand how to even think about inner ear problems.
Okay.
We're using these chapters from this ENT doctor,
Okay.
Dr. Audrey Latorre, from his website, idrope.info. And he has kind of a unique perspective on this because he used to do a lot of testing.
Right.
But he's really shifted to more of this like reasoning and patient experience focus.
Oh, cool.
Yeah, so it's really interesting how he frames it in the chapter called La Base per la Diagnosi, which is like the basics of diagnosis.
Mm-hmm.
He compares anatomy to the constitution of medicine.
Oh,
It's
okay.
like, that's the foundation.
Right.
If you don't understand that,
Yeah.
you're not going to understand how things go wrong.
That's true.
You know,
Yeah.
it reminds me of how some people think tinnitus comes from neck problems,
Oh, really?
but the structures aren't even connected,
Right.
you know?
Yeah.
So that's a big one that he talks about in this chapter. And he also kind of clarifies
Okay.
this thing that's often misunderstood,
Mhm.
the difference between hydrops
Oh, yeah.
and Meniere's disease.
I've heard of that, but I don't really know what that is.
Right, yeah. So hydrops is a condition where there's like an imbalance of fluid in the inner ear.
Gosh.
Meniere is a syndrome, which is like a collection of symptoms.
Okay.
And it's often caused by hydrops.
So you're saying I could have hydrops and not have Meniere's?
Exactly.
Okay.
You can have hydrops without having the full-blown Meniere's disease.
That's interesting.
And so that's kind of a crucial distinction to understand because that's going to impact how doctors approach the diagnosis and the treatment.
Right.
Let's talk about symptoms.
Okay.
He gets into this in chapter 9.
All right.
La valutazione dei sintomi, which means the evaluation of symptoms.
Okay.
And this seems like a really crucial piece of this puzzle.
Gotcha.
He explains that symptoms can either point directly to hydrops, especially if they're fluctuating,
Okay.
or they might suggest
Okay.
the possibility of some permanent damage.
Interesting.
So if my symptoms are coming and going, that's a good sign.
Well, according to him, if it's coming and going, it means that hydrops is the likely culprit.
Uh-huh.
Yeah.
But he says something really interesting here.
Hmm.
He says that it's impossible to confirm permanent damage
Wow.
with current testing.
With the current testing.
So what if a symptom is constant?
Right.
Does that always mean permanent damage?
That's what I always thought.
Yeah, me too.
Yeah.
But that was a big revelation for me when I read this.
Really?
Was that even a constant symptom
Yeah.
could still have like a hydrops component that's kind of driving the problem?
Wow.
So that changes how we think about treatment.
Right.
Because even without a definitive diagnosis,
Okay.
addressing hydrops is really the only option we have.
So it doesn't really matter if you know for sure or not.
Right.
You've got to treat it anyway.
So, big takeaway
Yeah.
for someone listening who's dealing with these issues.
Okay.
Don't get hung up on labels and syndromes.
Right.
Focus on treating the individual symptoms that you're experiencing.
So each one individual.
Each one individually.
Yeah.
Even if you've got problems in both ears.
Right.
You know,
Right.
treat each ear separately.
Yeah.
Don't assume everything is connected.
Gotcha.
Don't try to link it to other health problems you have.
Unless there's a clear reason to.
Right.
Yeah.
Unless there's some clear evidence.
Okay.
So now let's move on to something I think is really intriguing.
Okay.
Chapter 10, La ricerca delle cause.
Which means?
Which means the research of the causes.
Okay.
And I love this chapter because he really challenges out of the conventional wisdom about what causes inner ear problems.
Oh, that's good.
Yeah, it's really interesting.
Yeah.
And he starts by ruling out the scary stuff like brain tumors.
Right. Gotta rule out the big stuff.
You know, you don't want to be dealing with a brain tumor.
No, nobody wants that.
Thank goodness.
Yeah.
But then he goes on to list all these
Okay.
impossible causes that doctors often blame for inner ear issues.
Oh, so these are things that people are blaming it on.
Yeah.
But he's saying they can't be.
But he says they're anatomically impossible.
Oh, wow.
So let's start with teeth and jaw problems.
Teeth.
Yeah, I've heard that one before.
I have to.
Yeah.
Yeah.
My dentist actually suggested that once.
Oh, really?
Yeah, he was like, maybe your jaw alignment is causing your tinnitus.
Interesting.
But he explains that there's simply no direct connection between the teeth and the inner ear.
Okay.
Anatomically,
Yeah.
it's not possible.
Oh, that's cool.
Yeah.
So the dentist is wrong.
So blaming tinnitus or vertigo
Yeah.
on a misaligned jaw is
Yeah.
it's just not logical.
Gotcha.
Okay, what about neck problems?
Neck problems.
Yeah.
Okay.
I've had chiropractors tell me that,
Oh, really?
yeah, my neck is causing my ear issues.
Wow.
You know, but again, he says that the neck and the inner ear
Right.
are totally separate systems.
Right.
There's no direct link.
Gotcha. It's like they're blaming the wrong system.
Yeah.
Yeah.
This is eye-opening. It's like a whole new way of thinking about these problems.
Yeah.
What other impossible culprits does he debunk.
Impossible culprits. Okay, let's see. Yeah. How about sinus issues?
Sinus issues, yeah.
People always blame their ear fullness on their sinuses.
And it kind of makes sense, but...
Right, but you say?
He emphasizes that there's no direct pathway for sinus problems to affect the inner ear.
So there's no connection.
It's another one of those anatomical impossibilities. Yeah, I'm starting to see a pattern here.
Me too.
What's next?
Okay, next up, circulation problems.
Circulation problems.
Yeah.
So some doctors say that poor blood flow.
Okay. To the inner ear can cause tinnitus or hearing loss.
But wouldn't that cause like permanent damage?
Yeah, that's what I was thinking.
If it was really poor blood flow.
Right.
Yeah, and he actually addresses that.
Oh, okay.
He says that the inner ear is so sensitive to blood flow that any significant disruption would cause immediate and irreversible damage.
Oh, okay.
It wouldn't cause the fluctuating symptoms we often see with inner ear disorders.
You can't beat that.
That makes a lot of sense.
It does.
Like we're debunking myths with anatomy and logic.
Yeah.
It's really cool.
Yeah, I love that.
So, what about viruses?
Viruses, okay.
A lot of people...
Yeah, people blame viruses for everything.
Yeah, they attribute your ear problems to a past viral infection.
Right.
But can't viruses cause inflammation?
Yeah.
That affects the ear.
That's what I thought.
Yeah, and he says that while that's true for the outer or middle ear...
Right.
The inner ear is a protected system. Viruses can't typically invade it directly.
Okay.
And plus, he says, any viral damage would be permanent.
Right.
Not the fluctuating kind that we see.
Yeah, that makes sense.
With eye drops.
Yeah.
So blaming a cold I had years ago for my current ear problem.
Right.
It's probably a stretch.
Yeah, probably not it.
Yeah, it's probably not. Yeah.
Okay.
He also debunks the idea that otosclerosis can cause inner ear symptoms.
Now, what is that?
That's a condition that affects the middle ear bones.
Okay, so that's middle ear.
Yeah, it's middle ear.
Gotcha.
It's amazing how many middle ear things are wrongly blamed.
Yeah, right.
For inner ear problems.
It's like people don't understand that it's a whole different area.
It's like a separate world back there.
Yeah, totally.
It's crazy.
Interesting.
And then, of course, he has to address COVID-19 and vaccines.
Right, everybody's talking about that.
Everybody wants to know, what are the long-term effects of COVID-19 on the inner ear?
That's the big question.
Yeah, and he's very clear that the virus itself can't enter the inner ear directly. However, he acknowledges that the stress associated with the illness, or even with the vaccination, could trigger or worsen high drops in some people.
So it's not the virus itself, it's the stress.
It's the stress. He even mentions this hormone ADH as a potential link between the stress and high drops.
Interesting.
And this makes sense because he says that most people who experience ear symptoms after COVID or the vaccine actually respond well to high drops treatment.
So that's good.
So that's reassuring.
Yeah.
It seems like knowledge really is power.
It is.
When it comes to these inner ear issues.
Knowledge is power. That's right.
Knowing that high drops could be the underlying cause.
Yeah.
Even in cases that seem linked to COVID. Gives us a starting point for finding effective treatment.
Right. You know where to start at least?
Yeah. You know where to start.
Yeah.
This has been so insightful. We've covered so much ground.
Yeah, from anatomy to symptoms.
Yeah, from understanding the basics of inner ear anatomy to debunking
all those myths.
All these common myths.
Yeah, there's a lot of
about what causes these problems.
It's amazing how much misinformation is out there.
It really is.
Yeah.
And speaking of getting to the bottom of things, his next chapter is Sintomi dell'orecchio.
Which means
the symptoms of the ear really dives into the specific ear symptoms.
All right.
And helps us understand what they mean.
Oh, that's cool.
Yeah, so it's like
a guide.
A field guide.
Yeah, to figuring out what's going on.
Deciphering those inner ear signals.
Right, yeah, exactly. That's a good way to put it.
Yeah.
Cool, well, let's dive into that then.
All right, let's do it.
Okay, so we're diving into chapter 11.
Okay.
I sintomi dell'orecchio.
The symptoms of the ear.
Yeah, which is all about understanding the different symptoms you might experience with your ears. And he starts by talking about symptoms that actually originate outside the inner ear.
Oh, okay.
Just to give us a broader perspective. For instance, itching in the ear.
Itching, okay.
Almost always means there's something going on in the outer ear canal.
Okay.
Like inflammation or an infection.
So not necessarily related to the inner ear at all.
Right. Not necessarily. It's a good reminder to consider all the possibilities before jumping to conclusions about the inner ear.
Right, right.
What about ear pain?
Ear pain, yeah. Could that be a sign of high drops?
Well, he calls ear pain atalgia.
Atalgia.
And he says it usually originates in the outer or middle ear, not the inner ear.
So if I'm feeling a sharp stabbing pain, that's probably not coming from the fluid imbalance.
Probably not.
Okay.
What about discharge from the ear?
Discharge, okay, yeah.
He calls that otorrhea.
Otorrhea.
Usually points to a problem in the outer or middle ear, often an infection.
Okay.
Of course, if there's a hole in the eardrum,
right,
the discharge could be coming from the middle ear.
Okay.
But even then, it's not coming from the inner ear,
right,
where hydrops occurs.
Okay, so itching, pain, and discharge are generally not signs of hydrops.
Right.
What about hearing loss?
Hearing loss.
Yeah, that's something we often associate with inner ear problems.
You're right. He calls that hypoacusis.
Hypoacusis, okay.
And it can involve any part of the ear.
Right.
And there are different types of hearing loss.
Right. There's conductive hearing loss, which is usually caused by something blocking the sound in the outer or middle ear.
Yeah.
And then there's sensorineural hearing loss,
right,
which involves the inner ear or the auditory nerve.
Exactly. And he points out that while hydrops can cause sensorineural hearing loss,
okay,
it's not the only possible cause.
Right.
Permanent damage to the inner ear or auditory nerve.
Right.
Can also lead to hearing loss.
So how can you tell if your hearing loss is caused by hydrops?
Okay.
Or something more permanent?
That's where paying attention to the specific characteristics of your symptom comes in.
Okay.
If the hearing loss is fluctuating, meaning it comes and goes or gets better and worse,
right,
that's a strong indication of hydrops.
Because it's the fluid imbalance that's causing the hearing to change.
Exactly.
Not permanent damage.
Not permanent damage, right.
Okay, so what if the hearing loss feels constant?
Okay, that's a good question.
Does that always mean permanent damage?
Well, that's what I always assume.
Me too.
But he reminds us
okay,
that even constant symptoms could have a hydrops component.
Really?
That's driving the problem.
Huh, interesting.
And remember, he emphasized earlier that we can't definitively diagnose permanent damage
right,
with current testing.
With the current test, okay.
So even if your hearing loss seems constant, hydrops shouldn't be ruled out.
Okay, are there other types of auditory distortions that could signal hydrops?
He talks about something called dysacusis.
Dysacusis?
Which is a change in how you hear sounds.
Okay.
It's not a loss of volume.
Okay.
But rather a distortion.
Okay.
Things might sound muffled or tinny.
Oh, I've experienced that before.
Have you?
Yeah, it's like the world sounds off.
Yeah.
Even if I can still hear things.
Right, and he says dysacusis can be a symptom of inner ear problems.
Okay.
Including hydrops.
Okay.
It's that fluid imbalance affecting how sound is processed.
Gotcha.
Okay, now what about that feeling of fullness or pressure in the ear?
Fullness. Okay, yeah, we talked about that earlier.
We did.
But it seems like it could have multiple causes.
It could. Yeah. He calls it fullness.
Okay.
Because it can feel like pressure or blockage.
Okay.
And it might be a simple blockage in the outer ear canal.
Okay.
Like earwax.
Oh, okay.
Or it could be a middle ear infection.
Right.
Or it could be hydrops affecting the inner ear.
So how do you narrow it down?
Again, pay attention to the details.
Okay.
If the fullness is fluctuating, coming and going, or changing in intensity, it's a good sign that hydrops might be involved.
So if my ear feels plugged sometimes, but not all the time,
right,
it's worth considering hydrops.
It could be.
Okay.
And if you've already ruled out any outer or middle ear problems, then hydrops becomes even more likely.
Okay, that makes sense.
Now let's talk about a symptom.
Okay.
That can be really distressing for people with tinnitus or ringing in the ears.
Tinnitus, okay.
This is a fascinating one.
Okay.
He explains that true tinnitus isn't actually a sound coming from the outside world.
Really?
It's a signal created within the auditory system itself.
So it's not like actually hearing a noise.
Right. Wow. He distinguishes true tinnitus, which is a continuous sound like ringing, buzzing, or hissing from other ear noises that are actual sounds, like clicking or crackling, or even your own heartbeat.
So if I hear my pulse in my ear, that's not technically tinnitus.
That's something else.
Okay.
Often called pulsatil tinnitus.
Pulsatil tinnitus. Okay.
Which is caused by actual sound vibrations.
Gotcha. So true, tinnitus is a continuous sound created by our brain.
By the brain.
Wow.
How does this relate to hydrops?
Yeah, how does that relate?
Well, he explains that hydrops can disrupt the delicate fluid balance in the inner ear, which can cause the auditory nerve to send abnormal signals to the brain.
So the fluid imbalance is basically messing with the signals.
Exactly.
Okay.
And just like with hearing loss and fullness, if the tinnitus is fluctuating, coming and going, getting louder and quieter, or changing in pitch, it's a strong indication that hydrops might be playing a role.
So if my tinnitus is changing over time, hydrops could be a factor.
It could be.
But what if it's constant?
Again, it's important to remember that even constant symptoms could have a hydrops component. And we can't definitively rule out hydrops based on how the symptom presents.
Each person's experience is unique.
It is.
What about hyperacusis?
Hyperacusis.
I've heard of that, where everyday sounds seem really loud and almost painful.
Yeah, it can be incredibly debilitating for people.
Yeah.
And he explains that hydrops can play a role. The fluid imbalance can affect how sound is processed.
Right.
Leading to that exaggerated response.
But it sounds like hyperacusis could have other causes too.
It can. It can also be caused by damage to the inner ear or auditory nerve.
Okay.
Or even problems in the central nervous system.
So it's a complex symptom.
It is.
That needs to be evaluated carefully.
It does.
Okay, now what about vestibular symptoms?
Vestibular symptoms, okay.
Those are the ones that are related to balance.
Right.
And spatial orientation.
Exactly, and he defines vertigo. Very specifically, he describes it as the feeling of movement.
Okay.
Either of the environment spinning around you.
Right.
Or of yourself moving through space.
So it's not just feeling lightheaded or off balance.
Right, it's a distinct sensation of movement. That's not actually happening.
That's not actually happening, wow.
And true vertigo always originates in the inner ear.
Okay.
Specifically in the vestibular system.
Okay, and we know that Meniere's disease,
right,
which is often caused by high drops,
yes,
is characterized by vertigo attacks.
Yes.
Are there other ways that high drops can cause vertigo?
There are.
Okay.
One way is that the fluid imbalance directly stimulates the balance receptors in the inner ear.
Okay.
Leading to that sudden, intense spinning sensation.
Okay.
But high drops can also disrupt the normal firing patterns of the balance nerves, cause them a more chronic, fluctuating sense of dizziness or imbalance.
So you might not feel spinning.
Right.
But you could still feel off balance or unsteady.
Exactly. He calls this subjective disequilibrium.
Subjective disequilibrium.
And it could be just as debilitating as vertigo attacks.
Wow.
He also mentions a rarer symptom called Tumarkin's otolithic crisis.
Tumarkin's otolithic crisis.
Which is a sudden fall without warning.
Oh, wow.
Or loss of consciousness.
Okay.
And he believes this is also caused by high drops.
Okay.
Affecting the vestibular system.
It's amazing how many different ways these inner ear problems can manifest.
It is.
Yeah.
And finally, he talks about a phenomenon called oscillopsia.
Oscillopsia.
Where objects in your visual field appear to be bouncing or jiggling.
Wow.
And he suggests this could be another sign of vestibular dysfunction.
So even visual disturbances?
Right.
Could be a clue that something's going on in the inner ear.
It's possible.
Wow, that's crazy.
All these systems are interconnected in complex ways.
This has been a really in-depth look.
It has.
At ear symptoms.
Yeah, we've covered a lot.
I'm starting to understand how challenging it can be to diagnose inner ear disorders.
It's not easy.
There are so many nuances and variations.
And that's why he emphasizes the importance of careful history taking, really listening to the patient's experience, and using logic and reasoning to make sense of it all.
It's not just about running tests.
Right.
It's about understanding the whole picture.
The whole picture.
And speaking of understanding the whole picture, his final chapter, La Consulenza Audio-Video,
which means
the audio-video consultation, is all about his unique approach to consultation.
Gotcha.
And how he uses telemedicine to help people with inner ear disorders.
Oh, that's interesting.
Yeah, so it's all about telemedicine.
Telemedicine, okay.
Which seems pretty unconventional.
Yeah, for a medical specialty.
For a medical specialty.
Yeah, it does.
But it makes a lot of sense in the context of inner ear disorders.
Okay.
Because remember how we talked about how you can't really physically examine the inner ear?
Right, you can't see it.
You can't see it.
Yeah.
He argues that traditional in-person visits are often unnecessary. For these kinds of problems.
Interesting.
So the focus kind of shifts away from that visual examination to really understanding the patient's experience.
Right. So it's more about listening to their story and understanding their unique symptoms.
Yeah. And then using that information along with, knowledge of anatomy and physiology to make a diagnosis.
So it's a more personalized and holistic approach.
I appreciate that.
Yeah.
Yeah. I like that a lot.
Me too.
And it fits with his emphasis on logic and reasoning that we've been talking about.
Not just ordering a bunch of tests.
Yeah, he's not just like running you through the mill.
Right.
He's actually using his expertise to interpret what you're telling him.
Right. And you need that to make the decisions.
I make informed decisions.
Yeah.
Especially since a lot of the standard tests don't really provide clear answers.
Yeah, they might show that something's going on, but they don't tell you what's causing it.
Or how to treat it.
Right? So this approach kind of streamlines things.
Yeah.
It cuts out unnecessary procedures. And focuses on what truly matters.
What matters is
the patient's experience. And an evidence-based approach to treatment.
I imagine some people might be hesitant about telemedicine. They might feel like they need to be in the same room.
Yeah, I could see that.
With a doctor.
Yeah, absolutely.
To really get that.
The proper pair.
Yeah, that in-person interaction.
Yeah.
Yeah. But he actually addresses that concern in this chapter.
Does he?
He lays out all the advantages of telemedicine, especially for inner ear disorders.
Oh, great. I'd love to hear this.
Okay, so benefit number 1.
Okay.
It eliminates geographical barriers.
Ooh, that's a good one.
So you can access specialized care from anywhere in the world.
Right.
You don't have to travel.
You don't have to relocate.
Yeah. So if you live in a rural area.
Exactly.
Or you have mobility limitations.
Yeah, that's huge.
This is a game changer.
It is.
It also makes specialized care more accessible
for
people with busy schedules.
Yeah.
You know, people who have trouble getting time off work.
Or if you have kids. It's hard to get out.
Yeah. You can schedule appointments during evenings or weekends.
Oh, that's great.
You don't have to worry about travel time.
Yeah, the flexibility is great.
So it's all about flexibility and convenience.
Exactly.
And because those appointments are often shorter and more focused, it can even reduce the overall cost of care.
That's a good point.
No more travel expenses or parking fees.
Especially for people with chronic conditions.
Right, this is huge.
Yeah, that adds up over time.
Are there any downsides?
Well, he actually says that telemedicine can foster a more collaborative and patient-centered approach to care.
How so?
Because communication is more direct.
Okay.
And patients often feel more comfortable asking questions.
In their own home.
Yeah, in their own space. Yeah.
It's more like the conversation than a formal doctor's visit.
Exactly. Yeah. And that open communication builds trust. And helps ensure the treatment plan is truly tailored
to that person.
To the individual,
His approach is really innovative.
It is.
And it seems like it has a lot of potential.
Yeah, especially for these types of conditions.
This has been such a fascinating deep dive.
It has.
We've learned so much about the inner ear.
Yeah, we've dispelled some common myths.
We've dispelled those myths.
Yeah.
And explored a really unique approach. To diagnosis and treatment.
Yeah, it's been great.
For anyone out there struggling with inner ear problems.
Yeah.
What's the key message?
Don't give up hope.
Don't give up hope.
There are effective treatments available.
Yeah.
And there are doctors out there like Dr. LaTorre. Who are dedicated to finding solutions.
It's easy to feel lost and alone.
It is.
When you're dealing with a health issue like this.
Absolutely. And I would add, be your own advocate.
Oh, that's good advice.
Arm yourself with knowledge.
Yeah.
Ask questions, and don't be afraid to seek second opinions.
Right.
Until you find a healthcare provider who really listens.
Yes.
And takes your concerns seriously.
That's good advice for any health issue.
It is.
Not just inner ear problems.
Absolutely.
Well, on that note, it's time to wrap up this episode of The Deep Dive.
All right.
We've explored the world of inner ear disorders.
Ours have.
And I think we've all come away with a deeper understanding. Of these often misunderstood conditions.
Yeah, they are misunderstood.
If you're interested in learning more about Dr. LaTorre's work, be sure to visit his website, eyedrope.info.
I know.
He's clearly passionate about sharing his knowledge and helping people find relief.
It seems like it.
And as always, we encourage you to keep exploring, questioning, and diving deeper into the topics that intrigue you.
That's what we do.
That's what the Deep Dive is all about.
That's it.
Thanks for joining us.
Thanks for having me.
We'll see you next time for another fascinating exploration.
Can't wait.